Hi, this is Dr. Riley from RBK Pediatrics. Yeah, today I want to talk to you about the cardiac complications of COVID 19. The AP has put out new recommendations regarding COVID 19 and athletes. And since I'm a pediatrician, this is actually a big concern for us. So, this basically is what came out. It came out this month in March 2021. And the reason why the AP decided to actually make recommendations regarding return to play after a student has COVID 19 is because of studies like this, right? So, this is a study that they did in 54 consecutive student athletes. They were mostly males, right? They were about 19 years old, so these are college age kind of guys, and what they did is this: is they wanted to see what happens if you do like it's actually probably the most thorough exam that you can of the heart right after someone has the COVID, right? So they published their results, and the results are frankly kind of worrying, right? Where they see that of the symptomatic patients, fully almost a third of them will actually have some kind of change when they actually do the testing, right? And this kind of change would be something called either myocarditis or pericarditis. So that begs the question: what is myocarditis and what is pericarditis? So myo means muscle, card means heart, itis means inflammation. So it's an inflammation in the muscle of the heart. And you could see in this top picture, they show a picture of the healthy heart. And then you could see when someone has the myocarditis, there's actually swelling in the heart muscle. And I'm not sure if you see it so easily in this picture, but the usually what happens is this pumping part of the heart actually gets a little bit smaller, right? So then the heart can't do its job as efficiently as it should. And I think you could see it a little bit better what I'm talking about when we look at pericarditis, peri being around, card being heart and inflammation. So what happens is that there's a little sac that surrounds the heart. And if that fills with fluid, you can almost get the idea like, yeah, the heart gets smaller because the fluid actually causes an issue where the heart can't like pump blood as much, right? So yeah, so this is worrisome that this would happen after the coronavirus. So um what should I look out for? And basically, yeah, these are like a lot of symptoms. Like you can imagine, if you have inflammation in your heart, you might feel some kind of pain, right? It's kind of like when you're anemic, right? You can imagine your heart is not pumping blood good enough, right? So when you're anemic, I think people are familiar with that it's basically the same kind of thing. There's not enough oxygen going around in your body when your heart is not doing its job. So you could feel like tired or fatigued, weak, what we call exercise intolerance, where you can't really do the same amount of exercise as you did before because it's just, things are just not working as good, right? Sometimes people will get new onset palpitations, or if it's more severe, they might get fainting, like fainting when they exercise. Especially, it would be very worrisome kind of symptom, right? Any kind of respiratory symptoms, right? Because almost like when you're anemic, you might get this kind of issue where just like not enough blood carrying oxygen. So your heart is not doing the job. It's not pumping like it used to, and the person kind of notices that, right? So you can imagine with these kind of things, the AP decided to make recommendations, right? And these recommendations are that when you get the coronavirus, it's not just to jump in and do your sport, it's to go see a pediatrician, someone who's like an expert in the health of children, to get checked out first to make sure that they're okay, right? That they can go do their sport and that they don't have myocarditis or pericarditis. So that's the official recommendation now, right? If you have coronavirus, and in the report it says within the last 6 months, before you go off and do your heavy duty kind of sport, you're supposed to be cleared by the pediatrician first. They're supposed to check you, and there's certain recommendations like what I'm supposed to do when I check somebody, and then I decide whether or not you seem like you're good to go, right? And this has to be after a certain amount of time, right? So you're supposed to you're supposed to be already 10 days past the coronavirus at least, right? So it's not like you come to see me, I swab your nose, and then I clear you on that same day. No, because this is something that doesn't happen on the first day. This is something that happens after you've been sick for a little bit. So it's supposed to be at least 10 days. You're supposed to at least have one day where you're feeling better, right? So if on the 10th day you're still feeling horrible, that's not the day you come to get evaluated, because we're not going to clear you because you don't feel good, right? Certainly if you're having a lot of these other symptoms like we described, we want to see you anyway, right? But it's the kind of thing you have to be good enough to actually be cleared actually for a sport, right? And then if we decide that yes, you seem like you're fine, you were asymptomatic and you seem like you're going to be fine, it's not like we are going to let you go jump in and do your sport. No, it's very much like when someone has a concussion, right? Now, back in the day, yeah, it used to be that we would clear someone and then the next day they would go play football, right? But that's not how it works now. And I think most student athletes are familiar with the rules for after you have a concussion. And the rules after you have the COVID are similar. There's a graded return to play. So, graded return to play, I've kind of shown in the slide accompanying this. And it is the kind of thing that you're supposed to slowly reintroduce yourself to your normal activity level. And certainly if you come to see us at RBK, we're going to give you a handout so you don't have to memorize the graded return to play. We'll actually give it to you, and those are what you're supposed to follow before you actually go and do your sport. But the graded return to play does not mean that, oh, I feel horrible on day 3, I'm going to push to go to day 4. No, if on day 3 you're actually having more symptoms, then yeah, you're supposed to go see the doctor, right? You're not supposed to kind of keep pushing. You're supposed to kind of be mature enough to say, okay, I'm really not doing good. I have to stop, because remember, the graded return to play is like a test to see how you're feeling, right? So yeah, so after you've been cleared, you don't necessarily have to come back and see me unless you fail the graded return to play. And it seems clear that this is going to not be the most common occurrence, although in this study is kind of scary. It seems our current experience is that most of the guys are actually going to do well. But it's very important to educate everyone that this is a thing, right? That this study is a real study, right? Where and there are actually other ones that show similar kind of findings. So it is important that before you actually do any kind of sport, that you get checked out to make sure you don't have any kind of problems. And then, yeah, usually the pediatricians will make the decision what you have to do, whether it's safe to go back and do your stuff or whether or not you need to see the cardiologist. Now, yeah, so finally, I just want to say, yeah, that with the coronavirus, a lot of things have changed, right? And it is the same way that we have all gotten used to wearing masks. I mean, now, and in the beginning, I felt a little bit weird going shopping with a mask, but now I've kind of gotten used to it, right? And I actually have patients that they're the healthiest they've ever been wearing their mask all the time this year. But it is a new change. It's something that we're going to ask kids to do that are different, and they have a lot on their plate. They have to study, they have to exercise. They're especially for the older ones, they're getting ready to go to college. They have to manage all these different kinds of things, and I feel bad because it's like I'm adding a new thing that they have to worry about. But yeah, the coronavirus is like a new kind of virus. We're learning a lot about it, right? So that we have new recommendations, I would say, yeah, this is just life in the time of corona. We're going to have to make changes, right? And so this is going to be one of the changes everyone is going to have to follow. So I would encourage everyone to share this video, because this is not just for people who come to RBK. This is really for every single student athlete in the United States is recommended to follow these recommendations. So I'm Dr. Riley, RBK Pediatrics. Thank you.